Is there anything that can tell us who's going to recover faster from a concussion and who won't? I'm Dr. Mark Heisig. Today we're going to look at a few of the factors that may be associated with prolonged concussion recovery. And of all the factors listed, most of them are not in your control, but one of them is absolutely in your control for the most part. And it's going to have a big outcome on how fast you recover. So when we look at the things that aren't in your control, what shows up in the research is having a history of headache disorder. So if you have a history of migraine or you have a history of some sort of headache condition, that's going to be more likely to have put you into the post-concussion bucket or the persistent concussion symptoms, PCS bucket. So a history of headache disorder, history of anxiety, depression, PTSD, any sort of the mental health bucket. Learning disabilities, so ADHD shows up as one of the risk factors for PCS. One of the really big ones is initial symptom burden. So initial symptom burden actually shows to be more important than some of these other factors. And what that means is the amount of symptoms and the severity of your symptoms that you have after the injury. So if two people are in the same conditions for an accident, they're both in a car moving at this speed and the car gets hit at that angle and all the conditions are the same, but one person walks away with a few symptoms and another person walks away with a boatload of symptoms, the person with a boatload of symptoms is probably going to take longer to recover, which is kind of intuitive. So all those things, though, they're not necessarily in your control. Having a history of headache, anxiety, depression, PTSD, learning disability, your initial symptom burden after injury, you can't really control for any of that. What you can control for the most part, is your time to see a provider, your time to seeing a concussion literate provider. Seeing a concussion literate provider can actually save you months on your concussion recovery. So when we look at some of the research, I'm pulling off some notes here. So when we look at some of the research on youth and pediatric patients, they kind of retroactively looked at these kids and how fast they recovered and how soon they got to the clinic after their injury. And so kids who got in to see the doctor on average 4 days after their injury, those 4-day kind of evaluated kids on average recovered in about 20 days. If they got to the doctor 4 days later and saw the doctor on day 8 after injury, they recovered in about 77 days. That is a 57-day, about a 2-month difference in recovery because you saw the doctor 4 days later. When we spread that age group out and we look at pediatric and adolescent kids, and we break it down into early, middle, and late evaluation, we see a very similar pattern. So early evaluation, you're evaluated within the first 2 weeks of your injury. Mid evaluation, you're evaluated 2 to 4 weeks from your injury. And late evaluation, you're evaluated more than 4 weeks after your injury. We see that early evaluation within 2 weeks is going to be about a 38-day recovery. Mid evaluation, so being evaluated 2 to 4 weeks from your injury, is going to be about a 51-day recovery. And late evaluation, being evaluated like a month after your injury, is going to be about a 148-day recovery. That is a 110-day difference between getting evaluated early within 2 weeks and getting evaluated late. So from what we see in the research, one of the best things you can do for your concussion recovery is actually getting to a concussion literate provider sooner rather than later. Whether you have a history of headache, mental health, learning disability, or you have a high initial symptom burden, the sooner you can get to see a concussion literate provider, the better off you're going to be. If you found this video helpful, go ahead and give it a thumbs up. If you'd like to learn more about concussion and PCS, go ahead and give my account a follow. Thank you for watching.